Hello friends and dear students, welcome back to my YouTube channel SS Pediatrics. My today's lecture is in continuation with my previous topic, that is hearing loss or deafness. In the previous lecture, I was discussed with you regarding the types of the hearing loss, and in my today's video lecture, I will discuss with the causes. What are the causes? What are the etiological factors which were responsible for causing hearing loss and the hearing impairment? So in this lecture, I will discuss with you regarding the causes such as some sudden traumatic injury towards the internal ear which leads to the hearing impairment, or some ototoxicity, some reason, sometime there may be, and sometime there may be noise induced hearing impairment. So let's start with the topic, causes of hearing loss. Start with the topic, causes of hearing loss. Known causes, first is hereditary sensorineural hearing loss. In this, the chances of hereditary sensory hearing loss is 1 in 3 of all cases of sensory neural hearing loss. First is syndromic, second is non-syndromic. In first syndromic, it usually present at birth, usually autosomal recessive. The example of this is Treacher-Collins syndrome, and in non-syndromic, it's based on the onset, whether it is from congenital form or it may include the late onset form, more common, and tend to be autonomic dysreflexia chances. In this, there is a overreaction of your autonomic nervous system, and it manifested later on after the birth of the baby. That baby is having this sensorineural hearing loss. Second one is noise induced hearing loss, which is caused direct mechanical trauma to the cochlea of the ear, and this include acute acoustic trauma and blast injury. And in this acute acoustic trauma, there is to be exceed 140 decibel and the pressure rises very short, example gunshot. And in blast injury, pressure wave from an explosive blast exceed 140 decibel, but the duration of the pressure rise is longer, and longer frequency spectrum and rupture tympanic membrane include in this. Next is acute noise induced hearing loss. High levels of continuous or intermittent noise for seconds to hours, often reversible or partially reversible, and muffled sensation and tinnitus in the ear. Example, loud power tools, rock accents and engine noise. And chronic noise induced hearing loss, irreversible cochlear hearing loss is to be there. And typical features of sensorineural hearing loss is to be there, and tinnitus can be constant and safe if level below 85 decibel for 8 hours per day. If a person used to work in such type of environment, then this there should be a safety if it is to be in between the level of the sound level is in between the 85 decibel. Next is the traumatic injury to inner ear. It further classified as the functional, which includes the labyrinthic concussion, and in structure labyrinthic contusion, temporal bone fracture, impact to the skull, accelerating and decelerating forces, and barotrauma. Symptoms non-specific, vertiginous complaints and hearing impairment in this. Next is ototoxicity. Toxic damage to inner ear affects both cochlear and vestibular functions. There may be due to some drugs which were mentioned in this list, and endogenous or exogenous effects should be there, and effect generally symmetrical, and symptoms tinnitus may be initial and presenting symptom. Next is presbycusis. Age-related hearing loss is to be there. Over the 50 years old person is to be found with this presbycusis, and it is to be symmetrical sensorineural hearing loss through the aging process, endogenous genetic predisposition, cumulative exposure to exogenous factors, and symptoms include the speech recognition more affected than pure tone, and diagnosis pure tone audiometry symmetrical sensorineural hearing loss is to be done to identify this problem. Next is sudden sensorineural hearing loss, immediate unilateral hearing loss with no apparent external cause. Symptomatic or idiopathic causes may be somewhere, some viral or vesicular autoimmune diseases to be there, and symptoms within second to hour, mild loss of hearing to sudden deafness. Vestibular symptoms less common. Next is the chronic progressive idiopathic sensorineural hearing loss. Bilateral sensorineural hearing loss onset before the age of 50 and the etiology is as such unknown, and the symptom variable, sudden hearing loss or progress gradually and frequently associated by tinnitus, and vestibular symptom generally absent. Pathophysiology, disorder of the external or the middle ear which leads to the interruption in the transmission of the sound by air to the inner ear and which leads to the conductive deafness, and disorder of inner ear or vestibular cochlear nerve or aging process that leads to the interpretation in the neural transmission of sound to brain and leads to the sensorineural deafness. Clinical manifestation, tinnitus, increasing inability to hear when in a group, need to turn up the volume of the television, failure to respond or inappropriate response to oral communications, excessively loud speech, strained facial expression, constant need for clarification of conversation and social withdrawal. So I hope you all were clear with my today topic, that is the causes of hearing loss, and in this I also include the pathophysiology and the clinical manifestation for this hearing loss. I hope you all were clear with the topic, and if you want to listen more regarding the pediatric nursing topic, then please subscribe my channel SS Pediatrics and please like and share my videos. Thank you.